Hello, my name is Chris,
And I'm Maya.
and today we will be discussing Obamacare and how it affects our national healthcare system. Many countries all over the world have had universal healthcare systems in place for many years. Several of these countries, like France and Germany, have better healthcare systems than the United States has ever had. The French system is so good, in fact, that it has been listed atop the list of the world's best healthcare systems since the early 2000s. Now, national health care for citizens of the United States has been a major topic of discussion over the last 4 or 5 years. In 2010, President Barack Obama signed the Affordable Care Act into law, stating that all Americans needed to have affordable health care by the year 2014. When this occurred, some 82 million Americans either had no health insurance or had inadequate insurance. ObamaCare, the common name for the Affordable Care Act, is aimed at giving Americans the health coverage they deserve at a price that they can afford. Throughout our proposal this afternoon, we will give a basic breakdown of what Obamacare is, as well as the healthcare systems in place in France and Germany. We will also provide our ideas for Obamacare that will help make it better over the course that it runs.
So you might be wondering what Obamacare is. It is also called the Affordable Care Act and was signed into law in 2010 by President Barack Obama. Estimated to cost $1.36 trillion to start by the year 2023, taxpayers will only see a tax increase of 0.9% up to that time. This means that most citizens will pay anywhere between 3 and 9.5% of their annual income every year to help start this. Some Americans will even receive subsidies to help cover the costs of health insurance if they can't afford it right away. One upside to Obamacare is young adults like college students entering the workforce after graduation can stay on their parents' plans until the age of 26. At that time, it's up to them to find their own health insurance. Also, companies cannot drop you for simply becoming sick like they can now.
Now that we have an overview of Obamacare, many Americans are unhappy with the Affordable Care Act as it stands now. Some options could be of adopting healthcare systems that are already in place in other countries that are successful there. One option is to adopt a style similar to the French. France is considered to have the #1 overall healthcare system in the world and spends about $3,300 a year per citizen, which is one of the more expensive systems, however not nearly as expensive as the U.S. system currently in place, which is close to $9,000. Almost everyone in France is covered mainly by national health care, and the rest that isn't covered by that is covered by their employer's insurance, which almost everybody has. Expensive long-term illnesses such as diabetes and cancer and mental illnesses are completely covered by the government. Cancer patients are also guaranteed to have any drug or treatment they may need, including the experimental drugs that are just coming out. New moms have prenatal and early childhood appointments covered completely by the government to encourage them to make sure that their baby will have everything they need. Workers pay about 21% of their income to the national healthcare system. Another option would be adopting a healthcare system similar to the German system. Universal health care is for all legal residents in Germany and was originally established in the late 1880s. However, it became a federal system in 1998 and became actual mandatory law in 2009. Workers in Germany that make under the equivalent of $65,000 a year are mandatorily covered by the government healthcare system, as are their dependent spouses and children. So everybody gets covered no matter what. One of the perks of the German system is the fact that the citizens have free choice and everything, even prescription drugs, are covered. This means that they can go to any practitioner they want to and everything will be covered. The contribution rate for employers and employees is about 1.95%, and those without children pay about 0.25% more. In Germany, quality and efficiency outweigh the cost for everything. Our recommendation, however, is to leave our current system in place and just add aspects from other countries that have worked for them. One of these being focusing on preventative care, like in Cuba. Doing this will decrease the overall number of illnesses every year over time. This will also allow us to have a healthier country. Another thing would be having doctors and nurses call home every 2 to 3 weeks, like in Germany, so that doctors can see their patients more as people and not as paychecks. And also, people will have more confidence in their doctors if they actually care about them as people. Another aspect be give mothers and fathers longer paid maternity and paternity leave, like they do in France. Another thing, like they do in many countries, would be to include complete coverage of all cancer treatments from the government. Let the families focus on getting better and their own personal family rather than having to pay for the treatments that are needed.
The question we all want answered is it feasible? Well, I'm here to tell you that it is. Currently, the ACA, Affordable Care Act, will affect roughly 15% of Americans that are not insured in the country right now. Under this, approximately 6 in 10 Americans can receive coverage for just under $100 a month, which is very affordable for most people. Also, the Affordable Care Act over the next 10 years is estimated to save the country roughly $200 billion. And over the next 20 years, that savings will escalate to $1 trillion over that time. So based on these savings, this plan definitely is a feasible one.
The Affordable Care Act is very costly to start. However, the savings in the long run is what the country is looking for. Based on the savings, the policy is definitely a feasible one, but will have to be monitored and adjusted accordingly over time. Nationwide healthcare in the United States is still a very young subject and is still just getting off its feet. As of now, it's hard to say if the system that has been set in place will help or hinder the country as a whole. However, with the 4 additions that we talked about in our proposal, we can hope to make this system work and make it the best for every citizen throughout the country. We are saying that just give the system a little bit more time before completely writing it off as a failure or a mistake for the entire country. We can't see how it will fully affect us until we've seen how it works over time. We would like to thank you for taking the time out of your day to listen to our proposal.
Thank you, and have a wonderful day.
You gonna put your phone down? You ready?
It is down. Over the last few...
It is hard to tell if the system has been... With these 4 additions that we talked about in our plan, the healthcare system... Mother!
Yeah, I don't like you right now.
Yeah, what's new?
Hi. What am I going to do with you?
That's for you to figure out.
Good afternoon. I'm Chris.
And I'm Maya.
And today we're going to... Wow. Terrible.
We would like to thank you for taking the time out of your day to listen to our proposal.